I've probably just had the biggest shock of my life recently, very recently.
My diagnosis almost didn't take place for my breast cancer. I wasn't going to go for my mammogram. I was busy.
On the 1st of January 2013, I discovered a lump myself, and on the 3rd of January I went to my GP. And within 15 days I was tested and diagnosed at the Linda McCartney Centre.
It was my gut feeling that was telling me that there was something wrong. Although I had had a mammogram maybe 18 months before, my gut feeling was saying it wasn't right. And if I hadn't have gone with that feeling, I probably wouldn't be here.
It's only small, and they are the only words that I remembered on that day. I have breast cancer and it's only small.
I think it's more of an instantaneous reaction. You don't have time to think, or there isn't a point where you make a conscious decision. Some people have said to me then, sometimes it's just your natural personality coming out. Everybody's different, and everybody sort of approaches the whole thing differently. Literally within the hour of being diagnosed, I fully accepted my diagnosis and looked in the mirror and told myself I had breast cancer.
I know it sounds very silly, but I just wanted to go home and put my trainers on and go for a good run. Just basically run away from it.
You wonder whether you'll ever get your life back. And that's the thing that worries you more than anything. Plus the fact, if you're a woman and it's breast cancer, there are two things. You worry in case you have to have chemotherapy and you lose your hair. And you also worry whether you lose your breast, and if you don't lose your breast, how deformed will your breast be after surgery?
It's so frightening, and it does change your life. It does definitely change your life. From that word, you've got cancer, it changes there. Not only for you, for your family, your friends.
You must keep your sense of humour. You must keep laughing. Don't let yourself get down into the doldrums.
It's not always as easy as it sounds being positive, you know, because you're struggling with the most horrendous diagnosis that you can have.
That's what you can't get your head around, because cancer and death go hand in hand. They always have done in everybody's mind. It's not true. And we know it's not true. We know that, you know, medical technology has moved on so much.
There is life after breast cancer. There really is. At 72, I'm still working, and I'm getting some of my old energy back.
So cancer and death do not go hand in hand anymore, but it is very difficult to push that death one out the door while the cancer's looming.
Being around people that are positive, I found, helped me.
But laugh. That is the important thing. Learn to laugh again.
I'm not taking it. I've got too much to live for. I want to see my daughter grow up and married and do lots of things that I've never done, and which I have done, only through doing the fundraising. I've done some dotty things.
The Linda McCartney Centre has been wonderful for me.
The most important thing is that there's a place like this where women can come, women can talk, women can cry, women can share.
Because everyone gets to know one another, and every time you come in, how's your treatment going? Are you doing okay?
They offered me the opportunity to return to Ireland for treatment where my family are, but I knew the Linda McCartney Centre was the best place and exactly where I wanted to stay.
From the day they walk through that door to the day they go into remission, and hopefully we never see them again, they are cared for, looked after and supported.
I couldn't believe everybody was just so kind, so caring, and I just felt that I was being put first.
I just consider it a world-class centre.
The Linda McCartney Centre has got some of the finest breast cancer nurses in the country, if not the finest.
You couldn't ask for anything better. People say to me, what do you think of the Linda McCartney? And it's the best. It's the best in the world.
I just can't imagine being anywhere else.
We see an awful lot of patients in the fundraising team, because people who come here, it makes them feel part of a family. It makes them feel like they want to give back and they want to help out the nurses and the doctors that have supported them along their journey with cancer.
The morning after my diagnosis, I straight away knew I wanted to raise money for the centre. And I came to learn that just one of my injections that I have with chemotherapy is worth £800. And I have had 8 of those during my chemotherapy cycles. So I decided to do 8 fundraisers to raise £8,000 for the centre.
Because I feel like the Linda McCartney saved my life. For me to fundraise and help out in any way I can, it doesn't, you know, anything I can do makes me feel good, because they've given me so much. That's my way of giving back.
NHS funding in reality can only go so far.
We need to raise as much money as we possibly can to make sure that, you know, we get in as much knowledge as we possibly can, so that this will happen less and less and less. Young mums are being taken from their families. Old mums are being taken from their families. It's not nice. It's a cruel, vicious disease. And the more money we raise, the better.
It is a cliche, but every penny does count.
I would never ever have been diagnosed with breast cancer if I hadn't gone for a mammogram. We fought for so long to have mammograms at an earlier age, and the day I was 50 I was waiting for the letter to pop through the door because I knew how important it was. I had a terrible time with my mum trying to get her to go. She just wouldn't go. She did eventually. I dragged her, kicking and screaming. But I dragged her because it's important, it's vital. And now I know even more so that it's vital, because you can't feel this lump I've got. Nobody can. It's only ever going to be picked up on a mammogram. So do yourself, your family, your friends a big favour, and the NHS, because they've supplied this for you. Please take advantage. Please go and have that screening.